Hello, everyone. Side effects of radiotherapy and chemotherapy are well understood. Can you mitigate some of the side effects with natural therapies like yoga, nutrition, or naturopathy? Well, we are going to talk to one of the top researchers today in our session. I am Amita from Nourish Doc, a platform for natural, holistic, and integrative therapy. Presenting this sensitive topic, we have top researcher Dr. Apar Avinash Saoji, PhD, Deputy Director, and Associate Professor at Swami Vivekananda Yoga Facility in Bangalore, India. He is a passionate educator, researcher, and clinician specializing in yoga therapy, naturopathy, acupuncture, nutrition, health, wellness, medical education, and stress management. Dr. Apar has published over 15 research papers in different scientific journals. Welcome, Dr. Apar.
Thank you so much, Amita. And it's a pleasure to be on this platform, Nourish Talk. It's a wonderful effort that you're making to ensure that healthcare providers from across the globe are coming together and meeting whom they should reach out to, the people who really require the help. So it's very nice to be with you.
Thank you. Thank you so much. And I know you've been our early supporters for the last 1.5, 2 years. So thank you so much. Let's start with some of the side effects of chemotherapy.
All right. Basically, as we understand across the globe, cancer is one of the most important cause of morbidity and mortality. It not only kills a lot of people, but it also significantly diminishes their ability, their quality of life. Uh, in fact, it was a dreaded problem until the conventional therapies came in picture, which were surgery, chemotherapy, radio, and recently immunotherapy, and there are many more. But now what we understand is the side effects of these cancer therapies itself can be more problematic than cancer itself. There is a lot of pain that people have, reduced quality of life, psychological distress is there. Um, and therefore, it is not sufficient to just go on with uh, the conventional ways of management. It requires a holistic approach because many a times it is not just the area that is affected with cancer that is a problem. It brings in a lot of stress and psychological dysfunction. Also, the next slide, if we go, we will have slightly more details. The side effects of chemo and radiotherapy are very well documented. Fatigue is one of the most important and most debilitating problem that happens with chemo and radio. Nausea and vomiting is another big problem because of which people lose appetite. They're unable to eat anything. And I've seen people undergoing these therapies, and because of the therapies, because they don't eat, they lose a lot of weight. There is constipation, there is hair loss, and hair loss could be a very common problem which is associated with reduced self-esteem. Lowered RBC count, the red blood cells which carry oxygen throughout the body, that reduces because the chemo and radio, although they kill the cancer cells, they also kill the normal cells in the body. And that is what creates a problem. They also kill the white blood cells, which leads to anemia, infections. It reduces our ability to fight any infections, and therefore there are recurrent infections. It also reduces the platelets, which are the blood cells which are uh, important for arresting bleeding, and therefore there is a tendency for bruising, bleeding, etc. And I'm just listed a very few of the side effects which are only at the physical level. At the level of psychology, there is so much of anxiety, there is fear of death, there is so much of distress. Going to hospitals and all these problems can be really, really painful for anyone.
So, why do you think yoga could be used as an intervention in cancer patients?
Well, yoga, as we understand from the traditional understanding from the Indian scriptures, we understand that yoga is not just a physical practice. It is a practice to essentially be with yourself, and therefore it is considered to be a practice that combines your mind and body. And now, what we understand with extensive research that has happened in cancer is that it doesn't only affect the body, but also the mind. And there is a very intricate connection between the mind and body. There is something called as psychoneuroimmunology that we understand today. If I'm stressed, what happens is there are a lot of chemicals, neurotransmitters that are synthesized in my brain, and that affects the way my immune system works. And when the immune system is compromised again, there can be a problem with cancer. So therefore, you need something that works at not just body, but also at the level of mind. And that is where yoga would be a wonderful tool, because it does not only address the body. Unlike in the Western world, where probably uh, sometimes yoga is taken very superficially at the level of the physical postures, there is much more to it, and there is a lot of mind to it, and that is where it would be wonderful. What we understand also is there are more than 500 research publications in yoga and cancer care, and they demonstrate wonderful beneficial effects in terms of what can happen to patients with cancer. In fact, the evidence is so strong now that the American Society of Clinical Oncology has recommended yoga as a part of integrative therapies during and after the breast cancer treatment. A lot of work has happened on breast cancer and yoga. Partially, some work has happened with yoga and prostate cancer, yoga with the blood cell cancer types, uh, lung cancers, head and neck cancer. So these are the major types of cancers with which yoga research has happened. In fact, the MD Anderson Cancer Center in the US, which is probably the largest cancer center in the world, also has a NIH funded yoga for breast cancer study, which is now under its conclusion. And the results are getting published in big journals across. Professor Lorenzo Cohen, who is the director for the Integrative Medicine Center, is the head there. And our institute, the Swami Vivekananda Yoga University in Bangalore, is a collaborative partner to this initiative because of the work that has happened in Bangalore with yoga and breast cancer. So we had a couple of researchers who have worked extensively in yoga and cancer.
That's actually amazing. That's really beautiful. For gives a lot of hope, and improves the quality of life for someone who's,
Absolutely,
you know,
absolutely.
cancer survivor. Let's talk about specifically about your research. You know, can you share the evidence of effectiveness of yoga for cancer?
Well, I have personally not worked with yoga and cancer in terms of the research work, but my institute has done extensive work in yoga and cancer. And some of these studies which are quoted here are done in collaboration with the MD Anderson Center, especially the cortisol study, which is quoted at number 4. Um, so what is known as when we have cancer and we are undergoing the therapies for cancer, the quality of life goes low. And we have understood that fatigue is there, there are psychological problems, there is sleep deprivation. So at all these levels, there is a huge evidence that yoga could be extremely beneficial. Yoga is known to reduce fatigue and depression in cancer patients. It is improving the quality of life, and this is again from a lot of studies which have happened across the world. I think the paper that I've quoted is a meta-analysis of multiple of these studies here, and what we understand is yoga definitely plays a significant role in improving the quality of life and sleep quality in patients with cancer. Of course, the symptoms get reduced, which are associated with the chemotherapy, radiotherapy, as well as the cancer disease as such. Also, the psychological functions like anxiety, depression, the perceived stress, all of that would come down if we do yoga in patients with cancer. One interesting study that came up with the MD Anderson collaboration was they looked at, along with the quality of life, they looked at the cortisol levels. Cortisol is a hormone that is an indicator of stress. Okay, so it's not just psychological feeling of an individual by doing yoga, they feel good, but also the cortisol levels when people undergo the radiotherapy, the cortisol levels are really high. So what was seen was when people did yoga, the cortisol levels came down steeply and they remained at a lower level than people who were in control group. So what we understand is if you're doing yoga, you can combat the stress much more effectively. You are more resilient to stress, even if you are going through a state of crisis because of the therapies and the health problem per se. Another study, which is, the area which is very important with cancer care is nausea and vomiting, because because of the nausea and vomiting, people lose appetite, they are unable to eat. There is a lot of problem. And unfortunately, the antiemetics, the drugs that are given to arrest nausea and vomiting, they are not really very effective. So that is where probably the holistic approach of yoga could be much more useful. In fact, there are also herbs which can be very useful, like ginger. There are studies which tell us that ginger could be very useful. But this particular study, which I've quoted here, talks about there were two groups made. One group received the antiemetic medicines alone, and the other group did yoga along with the antiemetic medicines. And the people who underwent yoga along with the medications showed significantly lower nausea and vomiting when compared to people who just took medicines for their nausea and vomiting. And therefore, yoga could actually take care of the whole person per se, whether it is the physical problems or the psychological problems, or they're associated with the quality of life, or it could also be associated with the chemo and radiotherapy side effects. So a lot of it can be worked out. Some of which I have not quoted is yoga would help you to have a better body image. I have mentioned that when there is a hair loss, there is reduced self-esteem because of the way you start looking at your own body image. And it is known that if you're doing yoga, your body image perception enhances. And therefore, there are multiple ways through which yoga could be useful for patients with cancer.
So let's move on and talk about specifically what type of yoga we should practice.
Okay, it would again depend on what type of cancer it is. It would also depend on where, what stage of therapy are you, what is the stage of the cancer. So it is not one single type of yoga practices that I would really recommend. It would basically be based on the need of an individual. And again, in the traditional understanding of yoga, it was taught in what is called as Guru Shishya Parampara in Sanskrit, which means the teacher and the students. Teacher knew what the student requires, and he gave only that to the student. And therefore, it would be very important that we do not give a blanket therapy just because somebody has XYZ type of cancer, but certain general understandings of what can be done is slow and gentle stretches are definitely recommended. And the way you do the postures, yogic postures, not the advanced postures, not the headstands that we're talking about, but gentle postures, looking inwards, feeling your body, having awareness on your breathing, all that would help. We also have breathing practices which are called as pranayama, which can be extremely beneficial. My own doctoral work has been on pranayama, and I understand how impactful your breathing could be to modify the way your body functions. So, breathing could be an extremely useful tool over there. Meditation could help in terms of managing the psychological problems as well as the physical issues that can come in. There is a lot of relaxation. There is emphasis on relaxation, whatever yoga practices that you do. In fact, I would also give you a caution that you should not be practicing yoga thinking that there are no side effects of yoga. If you're doing yoga under a proper guidance, under a trained professional, there is no problem. But many a times there are people who claim to be yoga experts, but they really do not have that kind of training. It can be a problem. Uh, and one of the major problems could be the cancer metastasis to bones, where the bones are fragile. And if you do too much of stretching, probably there is a risk of fractures. So, therefore, you need to assess the health of an individual before you really recommend a specific kind of yoga practice for an individual. But these are the general guidelines with which yoga practices can definitely be done.
So someone who's a cancer survivor should seek out a yoga therapist, in your opinion?
Yes,
Uh,
definitely, definitely. Some trained professional should be the one.
that who can guide them or navigate them
Absolutely,
through
absolutely.
that. Okay. We have a question coming up. All right. So we'll take this question in 1 second. So apart from that, what are the other benefits of yoga that you could think of in cancer care specifically?
One of the things that we have observed, not with cancer per se, but with people who are doing yoga in general, there is an improved self-care behavior. What I mean is, I know that certain things are not good for me, but I end up doing that because there is a craving, there are problems because of which my mind is not under my control. It could be stress. So we understand how smoking can be extremely, uh, contributing to cancer. And therefore, if you can improve the self-care behavior, if you can improve the way you take care of yourself and you perceive yourself and understand that certain things are bad for me and I should not be doing those, once that happens, things become simpler. And that is where probably yoga could play a very, very important role in terms of improving the self-care behavior. So not only your physical problems are reducing, your psychological problems are reducing, your quality of life is improving, but also the way you start looking at yourself is going to change. And that is going to help with yoga. In cancer care, again, that is going to be very useful. The second major group, which typically we don't talk when we're talking of yoga and cancer care, is the people who care for the patients with cancer, the caregivers. The families of the patients with cancer are equally distressed. And there are studies, in fact, there are at least a few studies that I know, which were done on people who are caregivers for patients with cancer. And what is seen is the anxiety, the stress levels, the depression, the psychological problems that these caregivers have will definitely come down. In fact, the caregiver stresses sometimes so much that they end up having psychosomatic problems, high blood pressure, high blood sugar, etc. And therefore, another major benefit of doing yoga is going to be for the caregivers for the cancer patients.
That's very true. I think all of us have some family member, who's had cancer and living through the cancer, or we lost our dear ones because of cancer. So, all the cancer survivors who are listening to us, please reach out to your yoga therapist wherever you are, and start with the yoga. With that, we want to open it up for questions. I see questions coming up. All right, there's a large, big questions. So we have a therapist who has joined us.
Okay.
She's asking. She recognizes the benefit of yoga along with counseling. I have found that one without the other isn't beneficial. The
Mm-hmm.
individual needs to feel they have the opportunity to express what changes have been forced on them. So
Mm-hmm.
counseling helps the individual to feel heard and actualize changes and find acceptance.
Okay.
So how do you, what are your thoughts, yoga with the counseling approach that they're pointing
Okay.
out?
One of the things that probably I have not mentioned because of the paucity of time is the way yoga looks at human being. The human personality is not just the physical body. We talk of what is called as the Panchakosha model or the five sheets of existence. And that means that you're this body, you're the vital energy, you are the mind, you are the intellect, and the causal state of bliss. So definitely it is not just going to work if you're going to work only at the physical level. And therefore, at the mental level, there are practices which, again, I skip because probably the cultural differences in the way yoga is practiced. In India, it can be more of a cultural practice itself. It comes in generations. And therefore, we talk of having faith. Counseling is definitely a part of yoga therapy, which we do here. And therefore, I would definitely agree with the person who has asked the question. Is it Priscilla? Priscilla, if I'm correctly pronouncing your name. Yes, I do agree that counseling would definitely play a role in cancer care. So definitely yes.
So you also mentioned about meditation, but I was reading one of the research where they had done a research on mantras,
Mm-hmm.
the sound healing, right? So along with the Om, how it helps. So could you talk about how the mantras, chanting mantras like Om, helps with the nervous system? There has been a
Yes.
research that's been done as well.
Yes, definitely. I have a couple of studies which we have done myself and a couple of my colleagues. We have worked on Omkara, and there is a specific mantra called as Mahamrityunjaya mantra, which is supposed to give you strength to face a grieving situation, a grave situation like cancer as well. So, what we understand is whenever we are stressed, there is this autonomic nervous system which controls a lot of functions in our body. And whenever we chant mantras, especially with Om, this particular study was done with MRI scans of the brain, functional MRI scans. And what was found is if you're chanting Om, there is a specific area in the brain which is responsible for the vagus nerve, which is the parasympathetic nerve. Basically, vagus nerve, when it is active, it relaxes you, it calms you down. Okay, so the moment you are doing chanting of Om or other mantras which can be useful, what happens is this mental relaxation would start immediately. Another thing is probably a lot of patients who are undergoing cancer care may be bedridden. They may not be able to do physical practices so much. Okay. So some things that they can do lying on the bed could be chantings, and which can give them the ability to heal themselves. The vibrations are going to help you. So all of that is going to put together in a very nice package. A simple thing would be doing breathing exercises or chantings. Even if you are incapacitated to get up from your bed, you can continue to do these practices, and that could also help you to gain a lot of confidence, build your respiratory abilities, and all of that.
So, is there any particular breathing that you would recommend, like Kapalbhati? They talk about that, or I don't know if that's good or not, but any other particular breathing that you can tell our viewers that they can do at home or something, or you would rather have them talk to a yoga therapist?
I would say Kapalabhati you need to do with caution if you are doing it for cancer, uh, not for people who have survived it already and they are out of there is no remission, then probably they can do it. But for people who are active under active cancer care therapies, one thing would be to seek advice from a trained professional. Definitely don't start doing things on your own or watching YouTube. This is a trend that we see today. We see things in television or YouTube, and that is not how you should be doing yoga. But there are a couple of simple yoga breathing practices that can be very useful, even if you are unable to reach out to a therapist. Okay. One will be a simple abdominal breath. What you need to do is just focus your attention on your navel, look at your navel rising as you breathe in and it falling in as you breathe out. So a very, very simple tool, just closing your eyes and looking inwards and feeling your breath itself is going to bring a lot of change. The second possible uh, breathing exercise, which can be done by many people in most circumstances, is the alternate nostril breathing. Please do not hold the breath when you're doing it without guidance. When you're doing it on your own, probably unless somebody understands your capacity to do things, do not hold your breath. Let your breath be natural. Slow, deep breathing and alternate nostril breathing can be useful.
Thank you so much. Thank you so much. I think that this helps a lot. Any other questions before we wrap up? Okay. So, I think this has been a very, helpful session, we hope, for all the cancer survivors who are watching or who view us later on. Please let us know your feedback. We've written the emails here. We will be bringing more sessions like this with the Dr. Apar as well and other researchers. Before we wrap up, any final thoughts from you, Dr. Apar?
Yoga, the word yoga means to unite. The literal meaning of it is to unite, and it's so nice. Sometimes when we're talking of this COVID-19 pandemic, we are all scared, but at the other side of it, it is also uniting a lot of. I'm sorry, there is a lot of echo.
No, we can hear you. That's okay.
Yeah.
There was a blip. Yes.
Yeah. So it is the time that we come together. We have yoga not just in terms of the physical postures, not only at an individual level, but we unite together, not just for cancer care, but for humanity. That's what we saw when we started commemorating the International Day of Yoga. The whole world comes together for peace and harmony. And that is the way forward. Probably, if all of us are in tune with yoga, we are taking care of not only ourselves, but also of people around us. We have a lesser pollution, we have more control on our minds. Probably we will have a better mental, social harmony. And the cancers also will come down because we're not going to harm the environment around us. We are one with it. So not only in management or therapy, yoga should be useful, but it should also be considered as something to do with the society, and it should be something that helps us to prevent cancer as well.
That's very beautiful. I think yoga as a lifestyle is what we as humanity should adopt. I try to do yoga every day in the morning by myself. I wish I could spend more time, but I'm trying my best also to have yoga come to my life as a lifestyle on a daily basis, and that's the message. With that, I want to thank you so much, Dr. Apar, for being with us. I want to thank all the viewers for watching us. Please help us spread the word. Help us share these sessions and tell your friends how natural therapies can help you with improvement of quality of life if you are a cancer survivor or if you're not even a cancer survivor. Thank you so much. Namaste.
Namaste.